If you've identified a potential preventable risk factor for hypos for your inpatients with diabetes, it's really important to act. It's also really important to act if you think your patient is having an episode of hypoglycemia. If a patient is increasing their activity, for example, with the physiotherapist, and their blood sugar level at the start of that is on the lower side, it might be worth considering offering them a snack. If your patients turn down their meal, like in this example, do they need to have that quick-acting insulin if they're not eating any carbohydrate? If your patient is having an episode of hypoglycemia, it is important to act immediately. If your patient is conscious, then fast-acting carbohydrate is really important. It's really important to avoid using things like chocolate and cakes to treat hypos, because actually the carbohydrate in them is very complicated and it doesn't work quickly enough to correct low glucose levels. Don't forget, glucojuice is soon going to be known as Lift. Once you've identified the form of sugar that you're going to use to treat the patient's hypoglycemia, really important you recheck their blood glucose level within 15 minutes. Ideally staying with the patient during that time or making sure that you're keeping a close eye on them. When you recheck the blood glucose level and it's above 4, make sure you follow up with a carbohydrate snack if they're not due their next meal. If your patient is unconscious, then pull the emergency buzzer, get some support and make sure that you treat the glucose immediately with IV dextrose or IM glucagon. Remember, IM glucagon does not always work for patients that have been fasting or had hypos in the previous 24 hours, amongst other factors. Once you've treated the severe episode of hypoglycemia, it's really important to again wait 15 minutes and, like in the first scenario, recheck the glucose level. As the blood glucose levels improve, if the patient does become conscious and is able to take their hypo treatment orally, then swap to the oral hypo treatment pathway. As in scenario 1, once a glucose level is back up above 4, then you need to follow that up with a slightly more significant amount of carbohydrate to try and prevent further episodes of hypoglycemia. In summary, it is really important when there's a risk of hypoglycemia that you act immediately, whether that be to prevent hypoglycemia from occurring or to treat an episode of hypoglycemia that is already happening. And remember, by considering these things and acting quickly, we can be hypoprevention champions. Consider, act, notify.